Our leading product in terms of the amount of growth factors and cytokines is Impax. Impax offers a dual layer membrane, which means from the biologic standpoint, you've got double the cytokines, double the growth factors, all baked into one recipe. As these patients are dealing with chronic wounds, some of them have had these wounds for up to a year and a half's time. So we want to give them the best chance to heal, and we feel that Impax does that. Impax is also, it registers on the economic scale as one of the higher reimbursing products because of everything that goes into it. The Impax product for us is one of our leading products because it's been so revolutionary in terms of patient response in the time of which we're healing these chronic wounds. It actually looks like a Listerine strip, right? So our providers, physicians, and Ps say this doesn't look like much, but what's packed into this graft is 10 times baseline the cytokines that you would have if you had some sort of topical wound care management. These come in sizes 2x2, 2x3, 4x4, 4x6, all the way up to 4x8. It's a very thin layer, and it's an extracellular matrix doubled over. So we have a membrane on the bottom, a membrane on the top. Speaking specifically about Impax, we do it simply. We don't have to rehydrate the tissue, and we don't have to reconstitute it with fluid of any kind. It goes directly onto the wound bed. Another advantage for our providers is there's no wrong way to apply it, meaning you don't have to apply it with a certain side facing up or a certain side facing down. You simply open the sterile package, apply it to the bottom of the wound bed, and then you're putting a non-adhesive over the top. So these procedures take 7 to 10 minutes for all of our practitioners and our providers. The patients do well, it's seamless, it's painless, and they're moving on to the next week. Several different sources and several different types that we use, all are specific to that patient's needs. We utilize these membranes because they have all of the cytokines and the growth factors that our body normally produces. To give you an example, we had a 92 square centimeter wound on one of our patients. It was just below the knee, which typically you're looking at 10 months, possibly a year to heal that size wound. And Impax dual layer membrane was able to heal that and get enough granulated tissue within 7 weeks of treatment. Following a below the knee amputation, was able to get a prosthetic, whereas if we didn't heal this large wound utilizing Impax, she would have had an amputation just below the hip and been wheelchair bound for the rest of her life. So we've seen a huge impact in terms of patient response, specifically with the Impax grafts. Medicare is fully behind this product. They've seen the white papers enough to get behind it and reimburse this product. So while it's not reimbursed by all insurances, we have seen a lot of success with Medicare and Med Advantage plans reimbursing for this product. Thank you for visiting and learning a little bit more about Impax, our dual layer amniotic membrane. If you're a provider that wants to learn a little bit more about the product and how to get this into your patients or into your mid-levels hands, please reach out to us and we'll have someone at onboarding get back with you soon.